Why has this debate lasted so long? Well, one of the reasons is that we've seen a sexing up and a cherry-picking of the data, which has really complicated the debate. And I want to remind you of a comment that was attributed to Sir Richard Dearlove, the head of MI6, referred to as C, in the leaked minutes of the War Cabinet, which met in 10 Downing Street on the 23rd of July 2002. Dearlove had just come back from 3 days with George Tenet, who was then head of the CIA, and was being briefed on developments in the preparation for the war in Iraq in the United States. And he came back and reported to the War Cabinet in London, but the intelligence and facts were being fixed around the policy. Now, this is a very familiar situation for students of the war on drugs. Why does prohibition persist, despite all the evidence I've presented to you? And I think we can learn a lot from this statement, this comment by the former commentator from the Baltimore Sun, H.L.L. Mencken, who said, "The whole aim of practical politics is to keep the populace alarmed and hence clamorous to be led to safety by menacing it with an endless series of hobgoblins, all of them imaginary." I think many of us can relate to that. I think another problem we have is that effective drug policies are often unpopular, but popular drug policies, on the other hand, are often ineffective. The situation we're dealing with is that the prohibition sounds intuitively like it ought to work. The problem is that the empirical support for that is so weak. On the other hand, drug law reform is counterintuitive, but it is supported by a lot of evidence. So we have the same kind of problems advocating drug law reform as the people who advocate the abandonment of economic protectionism. There are similarities in those debates. Well, if we abandon global drug prohibition, what are the alternatives? And I think the common view that is now starting to emerge is that we should be regarding illicit drugs as primarily a health and social issue. There will always, of course, be a need for drug law enforcement, but it should not bear the burden, the primary burden, of drug policy. If we regard illicit drugs as primarily a health and social issue, that means increasing the funding for health and social interventions to the sorts of levels that have been enjoyed for decades by drug law enforcement. It means basing policy on evidence, trying to get the best return on investment. It means that we should be starting to reduce and perhaps even eliminate penalties for drug possession and consumption. It also would mean that we would have to dramatically alter the system for treating drug users, and that would entail expanding the capacity of the system, which can't at the moment meet the needs of all the drug users in the community, improving the quality of treatment, at least to the level of other parts of the health sector. It would also mean broadening the range of options. We would also have to start giving serious consideration to taxing and regulating cannabis, because that's such a big part of the cash flow of the illicit drug industry. And it may mean, not necessarily inevitably, but it may mean that at some time in the future we would have to give consideration to possibly allowing the commercial retail sale of dilute concentrations and small quantities of some illicit drugs. I remind you that before 1906 we did allow the sale of edible opium, which was taxed and regulated and sold in small quantities, and before 1913 Coca-Cola contained cocaine. So there are precedents for this in our very own community. In conclusion, global drug prohibition began 100 years ago. Began in Shanghai in 1909 at a meeting in that city, convened by the United States, attended by 13 countries. But in the system that has developed over several decades, we've been unable to reduce recreational use of illicit drugs. We've also been unable to ensure adequate supplies of these drugs for medicinal and scientific purposes. I'd argue that drug prohibition has failed comprehensively, also that it cannot be made to work, and this is now being increasingly recognised, but that the political elites have really known of the failure and futility of prohibition for some time. The adverse effects of persisting with global drug prohibition are very serious, and as I've shown you, include significant threats to national security. A new development is that drug law reform is now politically feasible. We need to start giving serious consideration to the alternatives, and I think the threshold step is regarding this problem as primarily a health and social issue. I'd also argue that we also need to give more consideration to reducing economic inequality, which has increased in many developed countries in recent years and many developing countries. Finally, I want to say to you that I think, although there are many bad ways to use illicit drugs, the worst way of all is to use illicit drugs for political purposes. Thank you.
Doctor, my name is Craig Miller. One of the problems I guess I have with your conclusion is that it doesn't seem to me to categorize drugs by level of danger. And I think that there's an awful lot of people these days who would broadly agree with the statement that marijuana, cannabis is, in a fairly benign category, but that certainly wouldn't be, so far as I understand, the criminal justice conclusion or the medical conclusion about something like amphetamines, for example, which have a tendency to put psychopathic killers on the street. Are you really saying that for all illegal drugs we should have one uniform policy such as you suggest?
Thank you. That's a very important question, and I can't really in a speech like this get all the detail I would like to get into, but this is a very important detail. First principle I want to establish is that global drug prohibition encourages less dangerous drugs to be driven out of the drug market by more dangerous drugs. So if we look, for example, in Asia, which half a century ago the Western communities encouraged one Asian country after another to ban opium smoking, and opium smoking has almost entirely disappeared from Asia. But opium smoking among elderly men was replaced by heroin injecting by young men who are sexually active. So we prepared inadvertently the very conditions that have made Asia now a major public health threat in terms of HIV spread. Asia is home to half the world's population, and what is driving the HIV epidemic in most parts of Asia now is injecting drug use. So I think it's reasonable to assume that if prohibition encourages more dangerous drugs to drive out less dangerous drugs, that if we moved to a health and social focus, as I'm recommending, what we would find is that less dangerous drugs would drive out more dangerous drugs. There are good reasons why prohibition encourages more dangerous drugs to replace less dangerous drugs. And the reason for that is that prohibition encourages the concentration of drugs to be increased. We saw, for example, in the United States, in alcohol prohibition, that the 1920 to 1933, we saw that beer was the first alcoholic beverage to disappear because it was no longer worth the risk of producing vast quantities of beer when you could produce much smaller quantities of wine and spirit, which with much greater chance of evading detection by the legal authorities. So this is the phenomenon we deal with, and the more concentrated the drugs are, the more dangerous they are, in the sense that a small miscalculation about the dose can result in a fatal overdose. So I know that's a sort of complicated argument to put, but really what I'm arguing is that if we moved back to the situation that existed before global drug prohibition became universal on our planet, we would see the emergence of milder drugs replacing the stronger drugs, because people would want to take milder drugs. So I would certainly, if you're asking for specifics, do I want to see 1 kilogram blocks of 100% heroin and cocaine at the supermarket checkout? Certainly not. I don't want to see that. I don't know anybody who does want to see that. But we have parts of the world today where low concentrations in small quantities of illicit drugs are currently available for retail sale. Colombia, Peru and Bolivia, cocaine tea bags are on sale. Parts of India, people can register for, if they're addicted, can register for opium and indeed get opium from government stores. So this does exist and has existed in a number of other countries around the world. That system that I just described in North India used to apply across South Asian former British colonies, used to apply in Iran pre-53. So we have precedents for this. It may sound very unfamiliar and threatening, but no, I'm not suggesting by any means that we would have a totally unregulated free-for-all market. I'm someone who believes strongly in regulation.
Richard Bronowski, University of Sydney. When I was there in the 90s, in the US ambassador in Mexico City, Jim Jones used to say that the huge consumer demand in America was pushing the whole of the heroin trade from Central America and cocaine. We've had a campaign against AIDS in Australia, the Skittle machine, the shock and horror of not wearing a condom. It seemed to have some effect, I think. Do you think the current advertisements we see in railway stations about a bloke lying on the ground melting from the inside, having had methamphetamines and other drugs, will have any effect at all? It doesn't seem to me that it will.
Well, there are 2 points there. Your regard to your first point, is it your argument in effect, is it a demand problem? Asking in effect, is it a demand problem or a supply problem? I think it's clear that it's a demand problem more than a supply problem. When Donald Rumsfeld appeared before the US Senate for his confirmation hearings as the Secretary of State, Secretary of Defense, he was asked whether, if he became Secretary of Defense, he would support US military activities to support the war on drugs. And he said, no, this is a demand problem, not a supply problem. And indeed, earlier this year, we had the current US Secretary of State, Hillary Clinton, in response to the situation in Mexico, saying exactly the same thing. And I think that this is really a common view now. Do the advertisements that you described have any effect? Well, that's been researched around the world, and the answer is the benefits are minimal and very temporary. If there is a benefit at all, the benefit is political, and we shouldn't forget the fact that we have the drug policy is being really driven by two things. It started off, the war on drugs began really as a political strategy, didn't begin as a public policy. And in fact, the person who suggested this was John Ehrlichman of Watergate fame, who was a member of the Committee for the Re-election of the President, the appropriately acronymed CREEP, for President Nixon. And he persuaded Nixon to start the war on drugs as a political strategy. And when he appeared on Capitol Hill in 1977 after going to prison for his Watergate crimes, Ehrlichman was asked whether the war on drugs had been a success, and he said, well, it's been a success as a political strategy, but that was all it was ever intended to be, and it was never intended to be a public policy, and the people who came after me in the White House never realised that. That's in Dan Boehm's book called Smoke and Mirrors, where he interviewed 200 major figures in the war on drugs. So the advertisements are a political phenomenon, they're not really a public health phenomenon, unlike the wonderful advertisements for HIV, which were also political because they, as Bill will explain, the intention was really to get this issue of HIV/AIDS onto the front pages, which it did, and also to deliver a truckload of money to allow an effective government response. And that ambition was also achieved in spades.
Thanks, Alex. You spend a fair bit of time in Southeast Asia. What always hits our headlines is when an Aussie gets arrested for drug trafficking or for some drug-related offence in those countries which have the death penalty for such offences. I'd like you to comment on how effective you think those extremely... You spoke a lot about the United States and about Pakistan and other states, but you haven't talked about the region closest to us, Would you comment about that, how effective it is, and possibly have an opinion about how less punitive actions in those states might improve our relationship with the region, on that front at least?
Yes, thank you. Well, Australia's really had a very important and very positive impact on the region in terms of its pragmatism in now responding to the HIV epidemic. One of the most depressing experiences of my life was going to a meeting in 1991 in Kuala Lumpur, convened by the World Health Organization. It was the first official meeting to look at HIV among injecting drug users in this region. And there were about 30 countries represented, and each country representative got up one after the other and said, we don't have this problem in my country. This is a problem that is, HIV is just a problem in you decadent Western countries, not in our country, and we don't have it in my country because we are Catholic, Buddhist, Hindu, Muslim, communist, capitalist, insert the appropriate descriptor. And even if we did have this problem, we would never adopt harm reduction. So that was in 1991. Now we have a situation where country after country in Asia, with very few exceptions, and certainly the only major exception amongst one of the major countries is Thailand, but all the other countries now accept harm reduction very explicitly and are also implementing harm reduction measures to control HIV. Coverage is still very low, but there's no doubt which direction things are heading. Vietnam has passed, the National Assembly's passed a harm reduction bill, and they're also are making legislative moves to decriminalise drugs. Things that hasn't come into play yet. So things are really happening. In Malaysia, we've seen the current Prime Minister Najib was really one of the first people in that country, in Malaysia, to recognise the seriousness of this epidemic while he was Deputy Prime Minister. Malaysia was really traumatised by the fact that the only one of the Millennium Development Goals that they missed out on was HIV control, and they missed out on it because of HIV infection among their injecting drug users, and they missed out on controlling HIV, as they know, because they didn't implement harm reduction because Mahathir wouldn't have it. So things are now turned around in Malaysia, in Indonesia, country after country, in China, in Taiwan. So huge change in drug policy, but as in many similar kind of instances, we see we're in a period of transition, and we see remnants of the old system still surviving, and one of those remnants is the retention of the death penalty in several of our Southeast Asian regional neighbours, and it's a serious problem. It's a serious problem for some of our citizens, and it's also a serious problem because you can't, on the one hand, try and control an HIV epidemic, a very serious epidemic, and on the other hand, have capital punishment. One has to go, and let's hope it'll be the death penalty that goes. We should remind ourselves that although from an Australian perspective AIDS is a forgotten issue, almost, it's globally, it's a very important issue. 1 in 6 deaths in the world today is due to AIDS, and outside sub-Saharan Africa, which accounts for 30% of the world AIDS epidemic, outside sub-Saharan Africa, 30% of all new cases involve injecting drug users. And it's through injecting drug users that the epidemic becomes generalised by reaching the whole community. So it's a very important issue. Australia's done well on this, and I think we have to, as part of our national policy, try and encourage our neighbours, and it won't be easy, to let go of the death penalty.
Michael Sexton, I think this is only a more specific version, really, of the first question that was asked, but I wanted to really look at it from the point of view of governments who would have to make changes to the existing system. If one assumes, I'm prepared to assume that for the moment, that the system of prohibition has largely failed, but I wonder what you do about a drug, for example, like ice, I assume you're not recommending general availability of it. Would you be talking about availability in some kind of clinical context? Because if you're not talking about either of those, then you're really left with the notion of complete prohibition, which was in a sense where we started from.
Okay, very good question. Joe Westermeyer, an American conservative psychiatrist, wrote a wonderful paper, which was sort of the background to my previous response to a similar question. Joe Westermeyer wrote a paper called The Pro-Heroin Effects of Anti-Opium Policies, and he described how the introduction of the opium smoking ban in 3 Asian countries resulted in the disappearance of opium smoking and its replacement by heroin injecting. And what I'm arguing is that if we move towards a health and social response to this problem, what we would find is that ice and similar drugs like that, crack, cocaine in the United States, highly dangerous drugs, rocket fuel drugs, which are products of prohibition, would disappear. The demand for them would disappear. So I'm not recommending, in answer to your specific question, no, I'm not recommending that ice would go on sale in Coles and Woolworths. I'm quite, would be opposed to that. What I'm hoping is, and I don't have data that I can't show you data for this, but I think there are strong arguments that we can make that if we were prepared to allow cocaine back in some kind of dilute form in small quantities, that we may satisfy the demand for a stimulant and we wouldn't have to keep on chasing the market. At the moment, the reason that the market is so attractive for some drug traffickers is because it's so incredibly lucrative. The strategy unit report that I mentioned before that the UK Cabinet had commissioned estimated that profit accounts for 26 to 58% of the drug traffickers, major drug traffickers' business in Afghanistan. There wouldn't be many commercial operations around the world that could boast that kind of profitability. So what's driving the market is that it is so lucrative, and what makes it so lucrative is because of drug law enforcement. That's the whole Achilles heel to this. So I think we have to take the oxygen out of that market, and the only way to do that, as George Shultz said, is to have a more regulated approach to this. I don't want the criminals regulating the market as they do today. I want to see the Minister for Health or the Minister for Consumer Affairs regulating the market.
My name's Anna Aquilina. I have worked in this area for about a decade. I was a member of the team in the strategy unit in the UK who did that analysis on the drugs market, and I've stayed in the field since. I agree with most of what you have said, and I'm certainly an adherent of harm reduction policy. However, I do not agree with the thesis that dangerous drugs would disappear if it were legalised or decriminalised. And indeed, on that project in the Cabinet Office, we did look at legalisation. We looked in every way possible to see the best mix of policies to reduce the harm to the UK from Class A drugs. And it all comes back to the complexity of the number of drugs available. And the recreational market and the hardcore market are fundamentally different in terms of the harms they cause that governments are concerned about. So I guess I want to add to that since that study, the UK has fundamentally changed its drugs policy, both in the international and domestic sphere. And just, even if it were decriminalised more than it is now, I mean, heroin prescription is already legal in the UK, it doesn't mean you can stop looking at organised crime in the markets. And even if, again, it were legalised, there would still be a black market. It's still a controlled substance. It would be taxed. That market would be undercut. So there was no way we could come up with that actually showed it was a way to reduce harm. I don't know if you have any analysis
Yes, I do,
on that.
and thank you for your comments. Well, you said so many wonderful things that it's hard to know where to start. But one of the principal things you said there was, which I think is very important and is very often overlooked, is that a tiny section of the drug market accounts disproportionately for a lot of the harm, and that one of the aims of sensible policy should be to try and get those people under some sort of control. And we can only do that by at least meeting them halfway. And one of the reasons, one of the strong arguments for the heroin prescription treatment programs that you've sensibly always had in the United Kingdom, one of the strong arguments for that is indeed in getting to that 5% or 10% of the heroin market. And a phenomenon of all drug markets is that a small part of the market accounts for a large part of the share of that market. So if we look at the legal drug alcohol, the 10% heaviest drinkers account for 50% of the alcohol consumed. The 20% heaviest drinkers account for 70% of the alcohol consumed. And we'd probably see, if we could measure it accurately with an illicit market, we'd probably see a very similar distribution for heroin and cocaine. And indeed, in the strategy unit paper, those kind of comments were also made. So I think that's clear, and I think that's another argument, another strong argument about why we need to have more flexible drug treatment policies to include those people. The second part of your question really dealt with the use of categorical terms, disappear. And I don't use categorical terms because we're never going to solve the drug problem. There is no solution to it. We can reduce it. And that's what we should sensibly be aiming at. So I don't, if you ask me the question that whether the drug market, the illicit drug market would disappear if all the things I wanted were going to happen, I would say no. We have a black market for tobacco in Australia. We have a black market, a smaller black market for alcohol. But the tobacco black market in Australia accounts for 10% of the total market in Australia, and it's probably higher in Britain. So let's not aim to eliminate the black market. It'd be wonderful if we could do that, but I'd be happy if it was substantially reduced. And the cannabis market in Australia is a very substantial market, and Kenneth Clements, a noted West Australian economist, has estimated that the cannabis black market is twice the size financially of our wine industry. And Australia's got a pretty healthy wine industry. So bringing that down, not eliminating it, but bringing that right down and taxing and regulating, why not?
Alex, I'd like to thank you so much for a truly outstanding presentation. One of the encouraging changes in the international climate since the election of President Obama is, I think, this renewed respect for and emphasis on the role of science in the public policy debate, the facts and the figures. So the debate is certainly underway and joined on the legalisation of drugs, what to do about the dramatic problems that you've outlined there. And we're very proud and pleased at the Lowy Institute that you're able to come along today and make your contribution to what is clearly going to be a very important and significant public policy debate in Australia and around the world in the coming few years. I'd like you to thank Alex Wodak.
Thank you.